Where does the dog scientist spend her day? At the laboratory. Why didn't the narwhal invite the unicorn to his party? He wanted to keep it real. What do you call a dragon with heartburn? Bad news for the nearest village.
Give yourself a bill!
You're listening to Weird Medicine with Dr. Steve on the Riotcast Network, riotcast.com.
I need some touching. Yeah, my carotid.
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, and now a podcast. I'm Dr. Steve, with my little pal, Night Nurse Evie, the perfect combination of brains and bootay. Hello, Night Nurse Evie.
Hello, Dr. Steve.
This is a show for people who had never listened to a medical show on the radio or the internet. If you have a question you're embarrassed to take to a regular medical provider, if you can't find an answer anywhere else, give us a call at 347-766-4323. That's 347. Very good. There you go. If you're listening to us live, the number is 754-227-3647. That's 754...
Pooh head.
No,
No?
no. 754-22 penis.
Oh, okay. Gotta work on that one.
Or 754 bare nip, which is my favorite.
Okay.
Follow us on Twitter at Weird Medicine, at Lady Diagnosis, and at Dr. Scott WM. Have you got your Twitter figured out yet?
Not yet.
Not yet. All right.
I've been out of town. So.
Although you are, your caricature is now on our main
Yes, it
thing.
is.
Have you seen it?
Yes.
Yeah, it's pretty cool. Got Night Nurse Evie in a toga. Visit our website at weirdmedicine.com for podcasts, medical news, and stuff you can buy. Or go to our merchandise store at cafepress.com/weirdmedicine. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on the show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. All right, very good. This will be a quickie because it's our Memorial Day special.
Yes.
So thank you all for your service to your country. We greatly appreciate you. And because we have Memorial Day off, I'm drinking beer, and we're going to do a 30-minute. How does that even make any sense?
I don't know.
How did Memorial Day turn into, well, you get a day off so you can drink beer and cook out?
I don't want alcohol today. I just can't. I'm still hungover.
What are you hungover from?
Wine.
Were you strutting your stuff in the Milky Way?
Well, I had a mojito first, and then I had like 6 or 7 glasses of wine. So let's just say it was interesting.
Those effing mojitos. The first time I ever had one, I was on a business trip with Tacey, and it was in Palm Springs. Is it Palm Springs, Florida, or Palm Beach?
Palm Beach.
Is it?
Palm Beach is
Okay,
Florida.
okay.
Palm Springs is
California?
Yes.
Is it? Okay. I don't know. It's Palm something. But anyway, and they're walking around, and I didn't realize the culture at her company was basically alcoholic. And but these people were walking around with these things that looked like lemonade with mint in it, right?
Yeah.
And I'm like, oh hell, that looks. We were just gotten off the plane. We were thirsty. It was hot. I drank like 3 of them, just grabbing them off this thing. Had no idea there was any alcohol in it. And that's like, what in the hell is wrong with me?
Yes.
It was another time I got surprised. We just talked about the last time I got
Yes.
surprised with stupid P.A. John's 9% ABV.
Yes.
Excellent, by the way. Imperial Hop Drop, it's called. So if you are ever near Upper East Tennessee You can buy his beer in the grocery store now.
Oh, right.
And
I'll try that.
or if you happen to be in a town called Johnson City, Tennessee, it's a college town. That's where P.A. John has his brewery. You go to JRH Brewing and go get your Imperial Hop Drop on. But let me warn you, he will not stop you from drinking 5 of those, and that's like drinking 15 regular beers. So it was that last one, which was really my last 3,
Yes, right.
that killed me.
Yeah. Well, I figured I should have probably not had the last 2 glasses of wine, you know, but I kind of...
I have a hard time controlling myself with wine, to be honest with you.
It's so easy to drink.
It tastes so good.
Yeah, and I can just...
And it feels good going down, and it's really hard.
Yeah,
So.
well, it doesn't taste so well coming up.
No. Oh, did you do one of those?
Yeah.
That's when my wife and I fell in love. We were in New Orleans, and she spent half the time puking in the hotel room.
God. It's so embarrassing, though, because it was really... I thought the trash can was there.
Oh, no.
And the trash can wasn't there, so I hit the bed.
Oh, come on.
Yeah.
And you're with your boyfriend?
Yeah.
Is he your boyfriend or just somebody you're strutting your stuff with?
Strutting my stuff right now.
Yeah, there you go.
Yeah, but the messed up part about it ruined my good bra.
Oh, really?
I had to throw it away. I'm so mad. That's a $60 bra.
Oh, damn. Well,
Yeah.
you have to buy, like, custom bras,
Yes,
right?
it's like, G-cup.
How in the hell do you get a bra for... people who have never seen you?
Yeah.
I mean, Night Nurse Evie was blessed with an abundance of tit meat.
Yes.
I don't know.
And ass, but
Yeah. So,
Yeah.
I mean, do you have to have people make these, or do they make bras that fit?
they make them, but you have to go to a special store to get them. You just can't go to any store.
So it's like instead of the big and tall men's store, it's
Yes.
like, big tit, big butt store.
Exactly. So it's, a G cup, so $60 at least.
Damn.
So I had to throw it away. I was pissed.
Well, it's got to have some mighty underpinning and stuff.
It does. It has to hold it up.
Oh, yeah.
Because these are...
Have you ever tried to... I always tried to figure out how you could weigh breast tissue. And I have a method, I think, that I've always wanted to try. And it would be water displacement.
Oh, okay.
So you would measure how much water, one boob would displace. Because it's hard. You can't just really lay it on a scale, right? Because your body's attached to it. But if you go from above and dip one boob into a properly designed tub and see how much water it displaces, then knowing the average density of breast tissue, you could calculate how much it weighs.
I want to say my chest is probably at least 8 pounds per boob, maybe.
Wow.
At least.
Yeah, the other way to do it would be to have you stand on a scale and then
Yeah.
have me come behind you and just lift them up.
Yeah, and see if that works.
And then we subtract the amount.
Yes.
And then
They're heavy, though. They're heavy. They hurt.
Uh-oh. No, I was trying to hit us. Never mind.
You can't.
That's right. Okay, of course. Okay, anyway.
Yeah,
All
you're
right.
right.
Okay, let's, hey, don't forget to go to stuff.drsteve.com. That's stuff.drsteve.com. There's a lot of products there that we talk about on the show, but also there's just a link to go straight to Amazon, and we are part of their affiliate program, and it really does make a big difference. So please use that whenever you want to shop at Amazon. Don't forget the Tennessee-based company, tweakedaudio.com. I always thought they were in California for some reason, mainly just because they're cool.
Yeah.
And all the, cool stuff like this comes from California, but they're in Franklin, Tennessee.
Get out of here.
You ever
Outside
been there?
Nashville.
Yeah.
Yeah.
You ever been there?
Franklin, no. Well, pass through it.
Well, anyway, tweakedaudio.com. Use offer code FLUID for 33% off your the best earbuds for the price on the market and the best customer service anywhere. And check out Dr. Scott's website at simplyherbals.net. I couldn't get a hold of him today, but we'll still plug his silly, wacky BS. And check out etncomedy.com. That's our comedy website. We're having Vic Henley August 2nd. It's a free concert with craft beer, hopefully by P.A. John, but if not, it'll be by Sleepy Owl Brewery. Or maybe both of them, and then there will be food trucks, including, we're hoping, Foodie Fiction, which is Chef Mike. You haven't met Chef Mike yet, but he's been on the show a few times.
Okay.
And we really wanted to do a podcast with Chef Mike and his wife and call it the Lawyer Bitch and the Chef, because she's an attorney.
Oh, okay.
And do sort of like a weird medicine for legal stuff and maybe even cooking. I don't know, just an odd thing. But they're both so proficient at what they do, they need their own separate podcast.
Right.
But just easier just to throw them together and do something with them. And if you are interested, I don't know why you would be, in getting archives of this show or premium content, go to premium.drsteve.com. For $1.99 a month, you can get access to our full catalog going way back. And there are some people that, they get turned on to the show and then they get pissed because there's 300 shows they can't listen to.
Right.
So one trick you can do, and I'm totally fine with you doing this, you pay the $1.99 and then go and just download all those shows and then just cancel it.
Right.
So for $2 you can have all those. If you want to keep it going, it is a nice way to help us out.
Yes, it is.
Keep things so I can keep paying Night Nurse Evie and Dr. Scott and Lady Diagnosis. So. Yeah, by the time I pay you assholes, there's nothing left for me. I mean, and that's fine. I just, I this is my dream, not yours, so I don't expect you all to do it for free. So, but anyway.
But I like it. I enjoy it.
Well, good. Well, okay, I won't pay you then.
No, you got no.
All right, you ready? Let's take some phone calls.
All right.
Number one thing, don't take advice from some asshole on the radio.
Well, there couldn't be any more truth to that or than that. Ronnie B., thank you very much for your input. And let's see who we've got here. Uh-oh.
Let's say I was planning on drinking a whole bunch. Would drinking a bunch of water help my liver? Is there any benefit? Thanks. Love the podcast.
Hey, thanks, man. Okay. So he's wondering if drinking a bunch of water will somehow help his liver. And the only thing I can say to that is, let's say that you drank, for every beer you drank, you then alternated it with an equal amount of water.
Right.
So if you did that, that would be half the alcohol that your liver would have to metabolize. So in that sense, yes. But otherwise, if you're thinking, well, somehow I'm diluting it, every ethanol molecule that hits your stomach that gets absorbed has to be metabolized, whether it's diluted in twice the water or not.
Yeah. So it's still got to go through the liver.
Yeah, it's still got to go through the liver, so that won't help. But just alternate. You can pace yourself better by saying, hey, I'm going to drink 12 ounces of water after every 12-ounce beer. And right, yeah, I know, easier said than done.
Yes.
Or you could do sparkling water and put a little lime in it or something like that, and it sort of fools you into thinking that you're drinking, but you're drinking half as much that way. And so, in that sense, that would help.
Sparkling water does not fool you. Does it fool you?
Yeah. If I'm saying I'm not going to drink tonight for whatever reason, if I get some sparkling water with or tonic water with a little lime in it or something, I can drink that all night and not even worry about the fact that there's no alcohol in it.
I can't do that.
Really?
Yeah.
You got to have the alcohol?
Yes, I can't do that.
You might have a problem.
Well, I don't like the taste of tonic or sparkling water.
Okay.
That's
well, see, I'll drink vodka tonics all the time.
Yeah. I just can't do that sparkling. It doesn't taste good to me.
Okay. Yeah. Well, that makes a difference. I wonder, do you drink, but you drink wine though, right?
Yes.
So I've not seen any non-alcoholic wine like I see non-alcoholic beer.
Right. But I don't drink wine all the time.
Okay.
So it's not every day.
So if you're drinking, you want to be drinking.
Wine, yeah.
Yeah. And you don't want to try to fool yourself.
Exactly. Because it's very few and far between.
Just not drink then.
Yeah.
So what do you drink if you're not drinking alcohol then?
I usually just drink water.
Water, yeah.
And lemon. That's it.
There you go. Well, just do that then.
Yeah. Save somebody's mattress.
All right. Yeah.
Hey, Dr. Steve, this is Rick.
How embarrassing is that? Yeah. Okay, so you're there with this guy that you're newly having intercourse with, right?
Right.
And he's taking you on this trip, figuring he's going to get to Bodie-O-Do, and instead he's got puke on his bed.
Well, I just kind of leaned over and I said, "Where is the trash can?" And he hands it to me, and I'm sitting there, and I'm like, "Okay, I'll be okay." And I set it down, and next thing you know, I'm crawling to the edge of the bed, trying to get to the trash can, and I can't reach it, and so I just kind of just let it go.
Was he just horrified?
He was like, "Oh my God, Are you kidding?" So, long story short, I took I cleaned up the mess the next day because there's no way I could function. I was that drunk.
Yeah.
So the next morning, and I took the sheets and just threw them away.
So, well, they're going to think you just stole the sheets then.
I'd rather just throw it away than leave it there.
Yeah, you just paid
It's
for 'em.
disgusting. I threw the towels away, the washcloth. It was just, oh my God.
Oh.
That was the worst.
Can you imagine working in a hotel as you know, or housekeeping and the
shit you come
absolute
across.
shit? I remember Howard Stern told a story. That was it was Sam Kinnison's girlfriend, and she was the one that Jim Baker. Oh, what the heck was her name? I know people are yelling at the radio, but anyway, apparently Sam got up in the middle of the night and walked around, thought he was going into the bathroom, took a shit right in the middle of the carpet, and then went back to sleep. And his girlfriend is up at 3 a.m. trying to clean his feces out of the out of the carpet with towels and stuff.
Oh God.
And but anyway,
Yeah,
we do stupid things when we're drinking.
Yes, we do.
Really, really stupid stuff.
I'll never do that again.
Hey, Dr. Steve, this is Rick. My mom is suffering from trigeminal neuralgia, and she's been interested in CBDs.
Okay, let's talk a little bit about what trigeminal neuralgia is. It is one of the most painful syndromes that we're aware of, and the trigeminal nerve comes out of the skull in in front of the face and then splits into 3. That's why it's called trigeminal. And we're not 100% sure what's going on. The nerve root is swelling, and it gets compressed by the surrounding tissues or the bone that it's passing through. Whatever, it hurts like an MF. I've seen people just begging to die with this. That's how bad it can be. It doesn't have to be that bad.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
So let's see what his question is.
But she doesn't know how to go about finding a reputable source. I was wondering if you or anybody else would have some advice on that. Thanks. And I listen on the podcast, so don't put her in serious. Thanks.
Okay. Well, good. Well, I'm glad I played it on this one. CBD oil is cannabidiol, and as long as it is derived from the hemp plant and not the pot plant, hemp basically is pot plant that doesn't produce THC,
Right,
or very much of it. And so my understanding is, and I'm not an expert on CBD oil, but my understanding is that if it's produced from the hemp plant, then cannabidiol is legal in all 50 states. So the question is, where do you find a reputable source? Well, if it's legal, I would start at a compounding pharmacist and ask them if they can supply you with it, because they're going to have a reasonable source of medication, and you want something that's actually been tested and has identified strength and all that kind of stuff. So I would start there. If you can't get it there, there are reputable sources online. Now, whether it will help for this is a whole nother thing, but I don't think there's a whole lot of harm to it. So she can try it. Right. What we usually use for trigeminal neuralgia is an anti-seizure medication called carbamazepine or Tegretol. And in about 50% of people it works for, it's like magic.
Oh, great.
But the other 50% end up having to, they try a combination of lots of different medications, and then sometimes you have to go to an anesthesiologist and have them just go up in there, or an ear, nose, and throat person, let them go in there and just kill the nerve.
Oh, God.
And you'll have a numb face, but at least you won't be in abject pain.
Let me ask you something. So what's the difference between the hemp oil and the cannabis oil, though? It says,
Well, okay, it just depends, because it's all oil, right?
Right.
So you can have hash oil, for example, that has tons and tons of THC in it. That's the stuff that really gets you going. There's other active ingredients in marijuana, but delta-9 THC is the biggie.
Okay.
And you can get plenty of that, and you could call that cannabis oil, or some people may call CBD oil cannabis oil. So you have to define your terms.
Because I know that they can work it, where they take out the THC from the marijuana itself too.
Well, you can, but it's just easier to use plants that aren't producing it.
Well, let's see. That's why I'm wondering why they don't just do that then. Makes more sense.
Using Dr. Scott's stuff.
Can you smell?
Yeah, all of a sudden, my nose just went crazy. Dr. Scott's sinus rinse is still my favorite thing that he makes, and you can get it at simplyherbals.net, and it is fantastic.
It is quite good.
Got,
did you try that salt, by the way?
Yeah,
ramp salt.
Yeah, did you try it?
I did. I did.
I thought it was really good. It's kind of like garlic salt.
It is. It's got a garlic oniony smell to it.
Yeah, it's different.
Yes.
It's a little more subtle and a little more complex than garlic salt. Yeah. So, if you want to get some of that, it's wvrampsalt.com.
Right.
It's westvirginiarampsalt.com. And we appreciate that guy. He just sent me some habanero ramp salt.
Oh, nice.
It's really pretty awesome. So, all right. Boy, this is allergies. I'm not.
Oh, is it? Okay.
I promise.
Don't breathe over this way.
And probably big old Cialis that I took giving me some nasal congestion. So, all right.
Hello, Dr. Steve. I am a studying EMT student, and we are about to talk about having babies and shit when I go back to class. But I figured it'd be better to ask you this question than to ask it in class. Maybe I'll do it anyway.
Yeah.
So is it healthy for a mother to eat her own placenta after she has the baby? Yeah. Thank you.
Okay. Is it healthy? Well, no, you got to define that.
Right.
There's protein and iron in there, and the placenta basically is the blood supply for the baby, but it does more than just supply blood. It's an active membrane, so there are things that are filtered through there. It's almost sort of acts to a certain extent like a kidney. Not really. The kidney, the baby's kidneys act like kidneys, but it will supply proteins and antibodies and stuff like that are soluble in the mother's blood and cross the placental barrier and get into the baby's blood supply. So, but what it also does is it protects the baby from the mother's immune system,
so that doesn't reject.
The mother's not rejecting it. Exactly right. Now that only works so far if you've got an RH positive baby and an RH negative mother.
Right.
The first time everything's fine, but the second time the mother's bloodstream will attack that baby.
Right.
And That's why we give this stuff called Rogam.
Yes.
Whenever you've got an Rh negative mother and an Rh positive father, and they'll just give it before they even. There's no harm in it,
Right.
and it makes blocking antibodies so that the mother doesn't mount an immune response to the Rh positive factor. This is why, by the way, Anne Boleyn got her head chopped off. Because Anne Boleyn was Rh negative, Henry VIII was Rh positive. Their firstborn was, became Queen Elizabeth.
Right.
But every other kid she had after that had hydrops because they didn't have knowledge of Rh factor. So you can have one normal kid, but then after that they'll all die in the womb.
So I think, the main benefit I would see is the cord blood, storing it for stem cells, but eating it?
Sure. Okay. Well, so that's a separate thing.
Yeah.
I did that. I have no idea if that'll ever do my kids any good, but we've got it. And I pay $90 a year to keep it on ice. Now, the placenta, if you're starving, if you're a cave person and you're starving, or you have limited protein, you can't afford to lose all that protein. So it makes sense to eat it. When my dog had 10 babies, she ate 10 placentas.
Yes, they will eat that. Yes.
To get all that stuff back.
Yeah.
So, but in this day and age, when my wife had her kid, they brought us a steak, afterward, and that had all the protein and iron she needed.
Yeah.
So she didn't have to eat the placenta. That's the modern version of eating the placenta, is have a nice high-protein meal after you deliver a baby.
I just couldn't eat the placenta. I can understand, the cord blood and keeping it, but...
Yeah, there's people who do it, but so you got to define, is it healthy? It's not going to do any harm.
Right.
But it's not neat. It's not
It's
necessary.
not needy, right.
It's not necessary.
Gotcha.
But, our ancestors probably, it made sense for them to eat the placenta. All right.
Dr. Steve.
Hey, man.
It's Marcus from North Carolina.
Marcus.
So, been drinking a bunch of beers today.
Of course.
Decided to come out in the yard and pick up some dog shit. It's a pretty hot day, but I feel like I'm sweating more than normal. Is it possible that when you're fucked up, you sweat more than you normally would if you're not fucked up?
Sure.
Just wanted to know if there's some medical knowledge you could drop on me. Thanks.
Well, alcohol is a peripheral vasodilator. In other words, it opens up capillaries in the skin. And it will make you feel warm when that happens, but it's an illusion. You're actually radiating off more heat. So people that drink alcohol, back in the day, if they were in Michigan or something going to a game, they would bring a flask to keep them warm, right?
Right.
But the more they drank, the more heat they're actually radiating away. So their core temperature was probably dropping. So that's an illusion. But because you're opening up those capillaries, you're also getting more blood to the sweat glands. And yes, you're going to sweat more.
Yeah.
So.
Makes sense.
Yep. All right.
Hey, Dr. Steve. Recently was diagnosed with high blood pressure. It seems to be genetic in my family. Is there any possible way, I've been losing some weight, that I can be pulled off this medication, or am I kind of be saddled with this for the rest of my life? Thank you. Love the
absolutely.
podcast.
Hey, thanks, man. Absolutely. There are lots of people walking around, and I'm one of them, who had high blood pressure that are no longer on high blood pressure medication. Night Nurse Evie says she is one as well.
Right, yes.
And so lifestyle management can make a difference. If you have, particularly if you have stage 1 hypertension, those are people that have just sort of low-level high blood pressure. And, you eat more green leafy vegetables, you increase your exercise. In Night Nurse Evie's example, you have more intercourse for prolonged periods of time that you didn't do for many years before that. Decrease the amount of salt in your diet. I don't think a low-salt diet is necessary. Just, you don't have to eat so many McDonald's French fries.
Right.
And when you do that, you may see your blood pressure come down. Now, there are also some supplements that you can take Of course, now you're taking a pill again. And we could talk about those if people are really interested in that. But there are some supplements that you can take that may help to lower your blood pressure. But really, the exercise and fixing your diet are the biggies, and not over drinking and not smoking cigarettes too.
Correct.
Cigarette smoking is nicotine is a vasoconstrictor, and if you decrease the caliber of the vessels, the pressure has to go up. That's just it's the laws of physics. So
Yes.
So those are the things you can do. Tell me about your high blood pressure and what you did.
I was diagnosed with it after my last son and went to the doctor. I didn't even know it was high, but I noticed I was having really bad headaches. So they put me on lisinopril. Took that for a while, and then I just started losing weight. I just started working out, changing my diet, stopped eating out, fast food, and the weight came off, and my high blood pressure went away.
Yeah, there you go. Yeah.
So,
you can do it.
It works, yes.
So, yes, you do not have to be on it forever. Now, people with a genetic predisposition to, really high blood pressure, they may have to be on medication.
Right.
And you just won't know until you try it. So I'll usually, if someone's stage 1, relatively, it's higher than normal, but not crazy high.
Yeah.
I will give them 6 months to get it down on their own. We're checking them every month, making sure that they're not getting into the stage 2 level where we really kind of have to treat you.
I think I was like borderline 140 over 80.
There you go.
Yeah.
There you go.
So it was. Let me ask you something. What about primrose for women? Does that benefit women?
Should find out.
I read something.
Okay.
For metabolism.
What does that mean? What the hell does that mean?
Premenopausal.
Okay.
That primrose actually benefits women's bodies the older that we get.
Okay. This would be a good question for Dr. Scott, but I'm going to
Yes,
look it
but
up
he's
and
not
see
here.
what the, okay. Well, effective dietary oils on peripheral neuropathy-related endpoints in dietary obese rats. Now, I'm interested in that. Omega-3 polyunsaturated fatty acids derived from fish oil. Okay, this is not primrose oil. Can be an effective treatment for neural and vascular complications associated with obesity. Well, I don't have that, but I do have peripheral neuropathy. I'm always looking for something. Okay. Well, I have nothing. There is a study called the Primrose Study, which is complicating things because that's what keeps coming up.
Right. Well, I'll just research it and then we'll come back to it next week. Next show.
Yeah, let's
do
okay,
that.
here we go. Herbs, vitamins, and minerals in premenstrual syndrome, a systematic review. 62 herbs, vitamins, and minerals were identified for which claims benefits for PMS were made, with evidence found for only 10. Heterogeneity of the length of trial, specific products and doses, and outcome measures predicted meta-analysis for any endpoint. Data supports the use of calcium for PMS and suggests that chasteberry and vitamin B6 may be effective. That's what I always gave people, was vitamin B6. You take 50 milligrams before, for a week before your period, and then all the way through your period and a week after. And it was supposed to be effective for premenstrual syndrome.
Okay.
But they said no evidence of benefit with evening primrose oil or magnesium oxide was found. So that's for PMS.
Okay.
So, okay, let me look at one more. Meta-analysis of randomized placebo-controlled clinical trials of evening primrose oil in atopic eczema. Okay, so these are people that have allergic skin. It said it had a simultaneous beneficial effect on itch and crusting, edema, and redness that becomes apparent between 4 and 8 weeks after treatment is initiated. The magnitude of this effect is reduced in association with increasing frequency of potent steroid use. So that's interesting.
Well, it says that it's used for breast pain, of course, PMS, like you said, endometriosis, and symptoms of menopause, for like hot flashes.
Okay.
And things.
Well, people are using black cohosh for hot flashes.
Okay.
Okay, here we go. A comparative study of the effect of black cohosh and evening primrose oil on menopausal hot flashes. Let's look at this one, then we'll move on.
Okay.
All right, here we go. Both herbs were effective in reduction of severity of hot flashes and improvement of quality of life, but it seems that black cohosh is more effective than primrose oil because it was able to reduce the number of hot flashes as well. And this is in the Journal of Educational Health Promotion, which is, it's not one of the biggies. But,
right.
But anyway, there you go. So, yeah, maybe some benefit, but there may be other things that are better.
Better, yeah.
Let's look at one more. The effect of oral evening primrose oil. And by the way, I'm looking this up on a website that anybody that's listening to this can look at, which is PubMed.com. It's got all the peer-reviewed and some not peer-reviewed articles in the medical literature. So let's see here. The effect of oral evening primrose oil on postmenopausal hot flashes, a randomized clinical trial. Now, this is a good, let's look at the method. 6-week randomized clinical trial, 56 menopausal women were participating in this study. So it's not a giant study, but it might be big enough to get a statistically significant answer. Patients were asked for their hot flash characteristics and responded to a hot flash related daily interference scale questionnaire before and after intervention. Participants were randomly assigned to take 2 capsules per day of placebo or evening primrose for a continuous 6 weeks. Then the improvement in hot flashes was compared between the 2 groups. So if they did this properly, it was a double-blinded placebo-controlled study. This is the best kind of evidence there is.
Yes.
So the results, the percent of improvement in hot flash frequency, severity, and duration were 39, 42, and 19% in the evening primrose group compared with, and here's the placebo group, 32, 32, and 18%. So hot flash severity went from 32% improvement to 39% improvement. So that means a third of the people who took the placebo said, "Yeah, I felt better." Yeah. That's how powerful the placebo effect is. And the absolute effect was only 7% more. You see that?
Yeah.
So it went from 32 to 39. The severity of those went from 32 to 42%, said that it was better. So again, another third said, yeah, I felt better. But in the primrose oil group, 42% said that they got better as far as severity. And then the duration went from 18% to 19%. So 1% improvement and said that they were shorter. Okay. Now here's where they look at the statistical significance. So all of that is interesting, but is it statistically significant in such a small group? It said, although all 3 characters of hot flash were ameliorated in evening primrose, in other words, there was improvement, although slight, in all 3 things that they looked at, only severity was significantly better in this arm compared with placebo, and the P was less than 0.05. And what that means is there was a 1 in 20 chance that this was from just random chance. So that's pretty good.
Yeah.
So the severity. So you could say from this that evening primrose oil does not statistically significantly decrease the frequency or the duration, but does seem to decrease the severity of the hot flashes.
Yes.
Okay. So there you go.
Okay, thank you.
That's how you look at stuff like that.
I appreciate it.
Well, there you go. Get you some primrose oil. All right. Okay. You about ready to get out of here?
Yeah.
Okay. Are you? Okay. Well, me too. Thanks always go to Night Nurse Evie. We can't forget Rob Sprance, Bob Kelly, Greg Hughes, Anthony Cumia, Jim Norton, Travis Teft, Eric Nagel, Roland Campos, Sam Roberts, Pat Duffy, Dennis Falcone, Ron Bennington, and Fez Watley, whose early support of this show has never gone unappreciated. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 8 p.m. Eastern, Sunday at 5 p.m. Eastern, on demand, which is the most important way to listen to it, and other times at Don Wickland's pleasure. Many thanks go to our listeners whose voicemails and topic ideas make this job very easy. Go to our website at drsteve.com for schedules and podcasts and other crap. And, we were supposed to do
the study,
we have 2 minutes to do that.
Okay.
We'll do it while
Or do you want to wait till
Yeah, no.
Okay, all right. Let's talk about erectile dysfunction in men. Is that what you want to talk about?
Yeah.
Okay.
Of course, I always want to talk about that.
And this is specifically for men who've had a prostatectomy.
Okay.
After they've, had prostate cancer. It's a cure of erectile dysfunction and to make the penis bigger, they found. Injecting stem cells into the base of the penis.
Damn, I'm all in.
Yes. So
where'd they get the stem cells from? Does it say?
It doesn't say where they got them from.
Is it?
But the scientists are located in Denmark, so they're still working on it.
Yeah.
So they're hoping to have more information by the end. They're hoping that men don't have to take pills all the time.
Yeah.
And the study so far, the men that have had the stem cell search, a year later, they're still able to get an erection.
Damn.
A hard erection.
Yeah.
Yes.
Good. A big, meaty,
yeah,
juicy.
a big one.
Yeah.
Yes. So.
Good.
I mean.
So stem cells in the base of the penis may be the answer for this.
Yes. It says that it restores the function for men who struggle to get an erection.
Yeah.
So, kudos. It can work.
Absolutely.
I mean, are you up for it? Now that makes sense.
Am I up for it? I know that was serendipitous, but
yes.
Yeah, I'm totally up for it.
Yes. And this was found because men who had undergone prostate surgery.
Yes.
Due to cancer.
Yeah.
And they thought they would, hey, try this. Let's see if this works.
Yeah. Try anything.
Yeah. And it's actually working. So they're still waiting on a few more. I think it was a trial of 70.
Okay.
We'll
follow up on that in the future. Till next time, check your stupid nuts for lumps, quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine.